Uh, the next one in chapter 42 is cephalosporins. It's a class, and the prototype is cephalexin. And again, the blue is like straight from the book, and the black is like, I guess, trying to retain the info. Anyway, so cephalo, you see how it sounds like like five? So just think it has 5 generations. So cephalosporins, 5. They have 5 generations of medications. And this is all generations, but I don't even know how to like categorize all of them. So still need to work on them. And each subsequent generation, this is all preliminary information. It's not the story yet. But anyway, each subsequent generation is more likely to reach cerebrospinal fluid. It's also more likely to be less susceptible to beta-lactamase. I don't know what that is. To be more effective against gram-negative organisms and anaerobes. And there are 5 generations, which I already talked about that. And how you can memorize that it's a broad spectrum bactericidal medication is that it's not just 1 or 2 generations, but it's like 5, right? So it's many, like broad. And so out of all these medications, only cefaclor is clear for PO use, meaning like cephalosporins, except this one drug, cefaclor, which is clear for PO use. Everything is either IV or IM. Yeah. So cefaclor is, so the way that I'm going to memorize this, just random information, is cefaclor is like chlorophyll, which is that green stuff, we learned it somewhere, like in AMP, or I don't even know. But anyway, it's chlorophyll. It's like the green stuff in like grass or whatever, which is in the food, and it's good for your body, so you can eat it. Meaning administration, you can take cefaclor, you can take it with food, but the important thing is you have to close the cefaclor it up in the refrigerator when you're done. So that's an administration thing to memorize. And there's a drug in the cephalosporins called ceftaroline, and the name, so Roland, like Carolyn. So Mrs. Carolyn is the only Mrs. out of all the Mrs. in the world who is effective against MRSA. So ceftaclorin is the only cephalosporin drug effective against MRSA. So just think Mrs. Carolyn, right? Ceftaroline, only one. If you see MRSA on the test, it's like, okay, Carolyn. And the story goes, the title is How to Bake a Lamb and a Buffalo with the Chef. So chef is going to represent cephalosporins, but buffalo also, because cephalo, they rhyme. A highly rated chef, like a Michelin star, a highly rated chef, which is cephalosporins, decided to kill and bake a lamb and a buffalo, cephalosporin, to throw a party for the birth of his first child. So if he has a child, that means it's safe for pregnancy. So cephalosporins are safe for pregnancy. Yeah, and lactation. And THU is therapeutic use. So therapeutic use is in here too because this kills bacteria. So the chef decided to kill and bake a lamb, right? So it's going to kill the bacteria. It's bactericidal. And it's with a high therapeutic index, the therapeutic use, because it's a highly rated Michelin star chef. So it's highly therapeutic index. So the title is How to Bake a Lamb and Buffalo. So it's a recipe. There are, I think, 6 steps in this recipe. The first one, you have to make sure not to cross-contaminate the buffalo or the lamb that we're killing with chicken. And remember from penicillin, from the earlier story, chicken pen. So chicken, just think chicken pen penicillin. And the adverse effect that this black line is talking about is cross-sensitivity, allergy, or hypersensitivity, anaphylaxis to penicillin. Chicken pen again. So this is an adverse effect. There's like 6. Urticaria, rash, hypertension, dyspnea, all the anaphylaxis, like hyperallergy symptoms. You have to stop the medication and notify the provider. And you also have to question patients with history of penicillin or cephalosporin allergies. But you can use this with only mild penicillin allergies. So if it's not like a severe penicillin allergies, you can still use it. But anyway, the thing to remember is that don't cross-contaminate, cross-sensitivity with chicken. You don't want to mix the meat together, right? And second in the recipe is you have to bleed out the meat before putting it in the hot oven tanning zone. So like you have to bleed out the meat before, you cook the thing, right? So the adverse effect is bleeding tendencies with cefotetan and ceftriaxone. So the hot oven reminds me of like a tanning zone, like a tanning place, tanning salon. So you got to bleed out the meat before putting it in the hot oven to cook it in the hot oven tanning zone, bleeding tendencies with cefotetan, and then the zone, XONE and the ZONE. And avoid for patients with bleeding disorders, taking anticoagulants. Take caution for bleeding tendencies, right? That's kind of like logical stuff. And then third step in the recipe is thrombophlebitis with IV infusion. This is a straight adverse effect. So it's not really a story. It's just thirdly, like THR, And another THR is you have to infuse this IV slowly over 3 to 5 minutes, like another 3 thingy, and dilute for bolus. And we know we have to rotate it for injection sites. And this one you just have to memorize because it's a Korean. Ned in Korean means fourth or four. See how it sounds like nephro, like kidney. So that's why I put it here. Nephro, kidney. Adverse effect is renal insufficiency, like renal insufficiency. So the chef has to lower the baking tray and toss the lamb. I need to recolor this. The lamb in there. You know how like you put the meat in the tray, like in the baking sheet in the oven, and you got to toss it like after like an hour or something, so it's cooked evenly. So you're tossing the lamb in there. You have to lower. So what this lower thing represents is giving a lower dose to prevent toxicity. So if the adverse effect is renal insufficiency, but you don't just stop cephalosporins, you don't just stop giving it, you just need to lower the dose, because if you don't, it's going to be toxic. So you just lower the baking tray and toss the lamb for toxic. Fifth step in the recipe is okay, I'm sorry, this is Korean again, but anyway, what this means is, how like there's like anthrax or something. It's not anthrax in this story, but where like animal diseases, they transfer to humans. So in order not to let that happen, you have to give the animals like antibiotics so all the bacteria in them can die, kind of, whatever. So cough, meaning like in Korean, we cough like that. That's how you cough. So it reminds me of colitis. Because the adverse effect of cephalosporins is, the fifth adverse effect is antibiotic, like you give the antibiotic to the animals. Antibiotic associated pseudomembranous colitis for like cough, right? Because you don't want that disease to transfer to you, because you're going to eat this lamb and buffalo and then get sick. And you want to see if the animal really did die before you actually eat it. So what this represents is it's a risk. It really did die, risk for developing C. diff, like C did die. No, not that one. C and then did. So it's a risk for developing C. diff. And also monitor for diarrhea. And it's did die, diarrhea. Oh, it's a lot of stuff. It's a lot of stretch, I know. But the last step is lastly, large animals like buffaloes, which is cephalosporins. Buffaloes are very muscular. It's very muscular animals. So before you cook it, I'm just translating it. Before you cook it, you have to, how like you like beat the meat with like a hammer. So then, so the meat can be tender when you eat it, like after you cook it. So what it means is you gotta like beat the meat like deep. And if the animal was alive, it would be really painful, right? So adverse effect is pain. For cephalosporins, the adverse effect is pain with intramuscular injection. IM injection should go deep. That's why it's you beat it deep into a large muscle mass like ventral gluteal. That's why it says lastly large. So it's a lot of like, I don't know what that is, like alliteration or something. I don't know. But you also have to tell the patient that it's going to be painful. And Mrs. Carolyn, that we talked about earlier, Carolyn representing ceftaroline, one of the drugs in the cephalosporin class, is trying to dissuade her husband, chef, from drinking alcohol at this party, because alcohol is not going to benefit his kid in the end, because remember, it's the birth of the first child. So she is 칼가라. What 칼가라 means is like she wants to like hurt him if he like, you know, slips up and drinks something. So 칼가라 means like you're like sharpening your 칼 is knife. She's not sharpening her knife. So 칼 like calcium. So she's doing that to put him in the heat zone to cook him now. But when you see zone, you're thinking about ceftriaxone. So what all this means is disulfiram reaction. What that is just alcohol intolerance, the book said. So that's dissuading her husband, chef, from drinking alcohol, because you have to avoid alcohol. Because if you drink alcohol, the interaction with cephalosporins is that you're going to have this thing, disulfiram reaction. So dissuade. And another interaction is probenecid, right? Alcohol is not going to benefit his kid in the end. Probenecid delays kidney renal excretion. Another interaction is calcium and ceftriaxone, right? It's 칼가라, like this means knife, 칼 to kill him in the heat zone, to kill him in the heat zone. So administration is not to give them, well, contraindication, I don't know. Just don't give it together. Yep.